everyone, and welcome to Talk Nerdy. Today is Monday, November 13th, 2023, and I'm the host of the show, Cara Santa Maria. And as always, I do want to thank those of you who make Talk Nerdy possible. Remember, Talk Nerdy is and will always be 100% free to download. And in order to make that possible, I do rely on the support of listeners just like you. It's been a while, I think, since I've given a full shout out to the patrons because I've been traveling so much since finishing my PhD and sort of readjusting before coming back home for good and starting my postdoc. So I do want to make sure that I give an appropriate shout out to my top patrons this week. They include Daniel Lang, David J.E. Smith, Mary Neva, Brian Holden, David Compton, Gabrielle F. Jaramillo, Joe Wilkinson, Pasquale Gelati, and Ulrika Hagman. Thank you all so much. I do want to also let you know that this episode may be slightly noisier than usual. I'm staying with a friend in Los Angeles. There's a bit of street noise behind me. And my interviewee, Dr. Jonathan Howard, is in New York, as you'll hear, and there's quite a bit of street noise behind him as well. So this is quite a city episode, but hopefully you can look past that. I have a great one for you this week. It's an important topic, especially given that there is a new COVID vaccine available now. So I had the opportunity to speak with Dr. Jonathan Howard. He is an associate professor of neurology and psychiatry at NYU's Langone Health, and he's also the chief of neurology at Bellevue. He writes often for science-based medicine. He's quite prolific on social media, sort of debunking pseudoscience and offering evidence-based, accurate, science-based medicine information. And he has a new book available. It's called We Want Them Infected: How the Failed Quest for Herd Immunity Led Doctors to Embrace the Anti-Vaccine Movement and Blinded Americans to the Threat of COVID. So without further ado, here he is, Dr. Jonathan Howard. Well, Jonathan, thank you so much for joining me today.
Thanks so much for having me. I sure appreciate it.
So we are going to be talking about your new book, We Want Them Infected. And really what we're going to be focusing on is, I guess, some of the difficulties early on in navigating the sort of commentary or the conversation around COVID, what maybe fueled some already existing anti-vax rhetoric, what really confused a lot of consumers, and where things are now, what the role physicians have in sort of affecting change here. I think that this is timely because even though your book came out, several months ago, there's a new vaccine out right now, and you see the whole kind of conversation coming back and just reiterating every time a new vaccine is released.
Yeah, no, absolutely. And uptake for this new vaccine is horrible, and I'm worried we're going to pay a price for it this winter. We'll see.
Yeah. So why don't you tell me early on, right here at the top, because I think the title is a really bold title, We Want Them Infected. Where did that come from, and what are you communicating there?
Yeah, so the title comes from a quote by a doctor by the name of Dr. Paul Alexander, who was an epidemiologist and official in the U.S. Department of Health and Human Services during the Trump administration. And on July 4th, 2020, before anyone had been vaccinated, he wrote an email which said, "Infants, kids, teens, young people, young adults, middle age, with no conditions, etc., have zero to little risk, so we use them to develop herd. We want them infected." So while doctors like myself were treating and dealing with overwhelming COVID outbreaks in the spring of 2020, and a little bit less so in the summer of New York City in 2020, there were a large number of doctors who were working at cross currents with us. We were trying to limit COVID infections, and these doctors were trying to do the opposite. And these doctors did not treat COVID patients for the most part, but they had a plan to purposefully infect young people with COVID, with the idea being that once enough young people were infected, herd immunity would arrive and the virus would go away. So it was this idea of getting rid of the virus by spreading the virus as widely as possible. Didn't work out so well.
Yeah, so I guess an important question, and I don't know how answerable this question is, would be, was this sort of plan, I don't know if you could call it a plan, but was this mentality a simply misguided, or was it actually, I don't know, I'm trying to think of just the right word for this, like, uh, not so much intentionally nefarious, but maybe neglectful, maybe not not really taking into account all of the available evidence. Because obviously, we think about when I was a child, we didn't have a chickenpox vaccine. There was no varicella vaccine, and that's what we did. We counted on herd immunity, but people got really, really sick. Like, it wasn't healthy to do this like thing that people used to do, which was like send kids to chickenpox parties so that they would intentionally get sick.
Yeah, so first of all, it was a formal plan to purposely infect people, and that was written up and published on October 4th, 2020. It was called the Great Barrington Declaration. I'm sure we'll talk more about that. But the authors of this had already met with President Trump in the summer of 2020, and the next day, on October 5th, 2020, they were invited to the White House to meet with Alexander Azar, and they later went on to advise Ron DeSantis, amongst other people. So it's interesting that you bring up the examples of chickenpox, because my mom took me to a chickenpox party when I was a kid. And
No, really?
I've given this a lot of thought. So when is it ethical to purposefully expose a child to a viral disease? I think 4 criteria have to be met. And 2 of them are met by COVID. So the first one is that you just can't avoid the virus the rest of your life, which is going to be true of COVID, right? A newborn today can't hope to dodge COVID. That is number 1. Number 2, the virus has to be milder for children than for adults, which is true of chickenpox and obviously true of COVID as well, with the exception of babies. Babies have a very high risk. The third feature, which COVID does not meet, but chickenpox does, is that one infection leads to permanent immunity. And the fourth feature, which chickenpox met at the time my mom exposed me, but does not meet today, and COVID also does not meet today, is there has to be no vaccine for it. So I think my mom was relatively ethical to expose me to chickenpox in the 1970s. It wasn't entirely risk-free, and I'm at risk for shingles now. My vaccinated children aren't going to be at risk for shingles, but under those very narrow circumstances, I think it can be ethical to expose a child to a viral disease. Now, the plan to purposefully infect children and young adults and young people, let me just state that case under the best terms possible. So the idea behind it was formulated actually very early in the pandemic, as early as March 2020. And it was based on this idea, which is true of COVID, that young people have much less risk than older people. And the idea, which I've alluded to already, is that once a certain amount of the population was immune, herd immunity would arrive. Older people who had been, in theory, sheltering in place and living at home for a few months would be able to emerge into a world where everyone had immunity to COVID and the virus sort of went away. Again, a lot of this was based on faith that one infection led to permanent immunity, and that there'd be not enough virus circulating in the community that herd immunity would arrive, essentially, which obviously didn't happen.
So obviously, we can look back after the fact with hindsight and say, clearly that was misguided at best. But at the time, yes, COVID was new, but SARS type viruses were not new. Like, we knew about SARS, we knew about MERS, and we even knew about coronaviruses, the forms of coronaviruses that caused, for example, some proportion of the common cold. So I'm just curious, based on, immunologists, epidemiologists, virologists, best available assumption, why did they think that a single infection would cause extended immunity?
I don't know. It was a little bit of an article of faith, I think. And even early in the pandemic, in the summer of 2020, there were doctors on Twitter essentially sort of saying that no, it's unlikely that one infection is going to lead to permanent immunity. So this was all a little bit of an article of faith about a brand new virus. Here you go. I found it. There was a Twitter thread by a Dr. Chad Pettit or Petit from July 24th, 2020, which he said, herd immunity requires that individuals who have been infected develop a long-lasting immunity. We don't know how long immunity lasts after infection with SARS-CoV-2. If we use other coronavirus as evidence, as guidance, it doesn't look good. Typically, the immunity that individuals develop after infection lasts about a year or two. This will become important. So, a lot of virologists were sort of signaling alarm bells that immunity might not last very long time. And unfortunately, they turned out to be right for both the virus and the vaccine. And I should say, you said one thing about we got herd immunity to chickenpox. Just a slight correction there. Humanity has never gotten herd immunity to a virus without a vaccine.
Yeah, so that's like what we were aiming for, but that didn't happen.
Correct. And this is because newborns don't arrive with natural immunity. So this is what used to happen with measles before the vaccine, is you would see the number of cases every year would go way up and down. It sort of looked like a sawtooth. A new crop of unimmune babies would be born. They would all get infected. Then the cases would fall the next year until a new crop of babies sort of arrived. Not that babies arrive in batches, but whatever.
But yeah, I mean, that makes sense. So the idea here is that obviously if anybody in the community is carrying it, the babies are just like completely vulnerable to it. But if the community is fully vaccinated, or at least vaccinated above a certain point, then you're not going to see this kind of, I guess the vulnerability is still there, but it's not as readily vulnerable. Like they're just less of a chance for a kid to get infected if like all the kids at school are vaccinated.
Correct. And that's the state that we have now for measles and for chickenpox. And there are still occasional outbreaks where you have pockets of under-vaccinated groups who cluster together. But an average newborn babies don't receive the measles vaccine until they're 1 year old. But an average baby can lead a typical baby life and not expect to get infected with measles, which is not the case with COVID and probably will never be the case with COVID. And let me just say, one thing about all of the doctors who formulated this plan, they really underestimated COVID at the beginning. In March and April of 2020, they wrote editorials in Stat News and the Wall Street Journal predicting that COVID would kill around 20 to 40,000 Americans. And as the death toll piled up, they didn't revise their initial predictions, unfortunately. Instead, a lot of them started spreading what became basically QAnon memes, that people were dying with COVID, not of COVID, that it was just old people who were dying anyway, that death certificates couldn't be trusted, or even worse, that it was doctors who killed patients through the inappropriate use of ventilators. So these ideas that became gospel amongst the right-wing science denialists originated from doctors at Stanford and Harvard and UCSF and Johns Hopkins, some of our top universities, which is really sort of astonishing.
I'm curious, like, just to kind of go back a little bit to the timeline and this question that, again, I don't even know really how informative this question is, but of whether this rhetoric or this intentionality was misguided or sort of like neglectful. How far were we from the vaccine at the point where there's this massive public health crisis and these individuals are saying, like, how do we put a lid on this early on? We've got social distancing, we've got education about, hand washing and proper hygiene. But like, other than that, what the hell can we do?
Yeah, there wasn't much to do in the spring of 2020, and no one knew how quickly we would develop a vaccine. That was by far the pandemic's maybe the only sort of happy surprise of the pandemic, and really, I think, the greatest medical achievement of my lifetime. To be fair to these doctors, they were worried about the consequences, and they were right to be worried about the consequences of prolonged school closures and prolonged lockdowns on people's mental health and in businesses, for example. I always take great care to recognize that I was sheltered from the worst consequences of lockdowns. My kids, had remote schooling for a year and a half. They were teenagers, which was not ideal. But I was never lonely. I worked throughout the pandemic. I never had to worry about a missed paycheck. So I was very fortunate and very protected from the worst harms of lockdowns. And I always take great pains to recognize that. But again, rather than recognize that they had underestimated COVID, they started spreading these conspiracy theories. And they underestimated COVID. I think it was a little bit worse than that, because they underestimated it in ways that were mathematically impossible. So let me give you an example of this. And I will name names for the first time. A doctor who takes up a large chunk of the book, Dr. John Ioannidis, who I imagine most of your listeners have heard of. He's maybe not exactly a household name, but he is one of America's most famous scientists, and he is extremely respected guru of evidence-based medicine. And I'd written favorably about him in some of my previous work. Seems like a very nice guy. But regardless, on April 9th, 2020, he gave an interview to the Washington Post where he said he predicted that about 40,000 Americans would die of COVID this season, whatever this season meant. By that date, about 20,000 Americans had already died, and 2,000 Americans were dying daily. So unless COVID essentially vanished that instant, his prediction would be falsified. And indeed, 8 days later, COVID's death toll exceeded 40,000 people. But rather than say, oops, I underestimated COVID, as a lot of people did at the beginning in good faith, and they admitted error, again, he started spreading these conspiracy theories that it really wasn't COVID that was killing people. It was just old people who were dying anyway when you happened to swab their nose and find SARS-CoV-2 in their nose. So and that had a very damaging effect.
So, I'm super curious because in my mind, I have this sort of division, and maybe this is fair, maybe this is unfair, sort of between like the Anthony Fauci's of the world and then the physician that you just mentioned. So we know that the way that science works, we know that the way that public health works is that we operate with limited information and we make the best decisions we can based on resourcing, based on available evidence, based on all of these different sort of variables. And then as new information comes in, we iterate and new messaging comes out. And so I almost see like, and maybe I'm oversimplifying it, but these two camps, the camps of the self-correcting, hey guys, this is how science works. And I know it's hard to follow because I said this thing last week and now I'm saying something different this week, but we've got to all stay together on this and keep moving forward based on what we're learning. And the sort of very, I think, American ideal of like, what I said before stands, I'm going to double down on it. If the new sort of information doesn't seem to match, I'm going to retrofit it to match and come up with a new narrative so that I don't have to have ever been wrong. And I think that this is like a big departure that I saw in the sort of bifurcation of public health messaging. Do you think that's a fair characterization?
Oh, absolutely. And I make this very explicit at certain points in the book. So I quote, for example, Dr. Paul Offit, who, again, probably most of your listeners have heard of, one of America's most eminent vaccine experts. And he predicted on March 2nd, 2020, that COVID would cause less than, quote, 1/10 of the damage that influenza causes every year in the United States.
Right.
He immediately, I mean, not immediately, but within a few weeks, acknowledged his error, saying, if you're going to be wrong in front of millions of people, make a complete ass of yourself. So let me read a quote from my book. My aim is not to collect quotations from doctors who made good faith errors in the middle of a rapidly changing pandemic, only to later recognize their mistakes. The doctors I discussed haven't just minimized COVID in an errant tweet or two. The errors and omissions I will describe are not isolated events. And I should say, my book has all of my errors in it. I try to hold myself to the same standards that I hold others. But these were doctors who from day one said COVID was overrated and was nothing to worry about, and repeated that every month of the pandemic. Whether new variants were coming, they said, don't worry about new variants. They said, now is not the time to panic. Now is not the time to fear, etc. Again, because they wanted them infected. I think once you grasp that reality, that they wanted us, young, healthy people, to get COVID, all of their statements make a lot of sense.
Yeah. So, like when I mentioned Fauci before, would you put him in the same camp as Offit?
Best as I can tell, yeah. I mean, he has made some goofs. He initially told people not to wear masks, and I think he later regretted that comment. And he has probably spoken more and more publicly about COVID than anyone else. And so the idea that he would get everything right is going to be 0%, especially because this was everyone's first pandemic. The virus has changed a ton. The vaccines have changed a ton. I mean, think about it. The world's leading virus expert, if he fell into a coma on New Year's 2020 and awoke today, would be useless at anything with regards to COVID. And you could even say that, let's say you knew everything there was to know about COVID during 2020, during the first year, and then you fell asleep into a coma and awoke today, you would be useless today. You would know nothing about Delta. You would know nothing about Omicron. You would think the vaccines were 95% effective. And unfortunately, that wasn't the case. So yeah, anyone who comments publicly is going to make some mistakes. But I really think the measure of a scientist is exactly what you say, that people who acknowledge their errors, they speak in a humble fashion, and they don't become attached to their ideas. A lot of the doctors who I write about reacted. They couldn't separate themselves from their ideas. So if you criticize their ideas, they would say, oh, you're attacking me. You're trying to silence me. You're trying to suppress me. They were very good at the victim complex.
Yeah. And so, I think the one thing that we haven't kind of dived into yet, which is such an important part of this, is the behavior change that these expert views enabled or affected. So I think that there's sort of, again, different camps when it comes to, I mentioned the bifurcation of that scientific view of adjusting advice and adjusting information based on available evidence and doubling down and saying, I've never been wrong, which is very political, but also very American. But there's also this kind of, I guess, maybe not so much a bifurcation, but a categorization of the sort of experts who are propagating misinformation, disinformation, pseudoscience, and then the sort of non-experts who are also doing the same thing. And very often there is an agenda involved, but regardless, I think that it's hard as a consumer when you see a physician or an epidemiologist giving bad health information to know the difference between what's evidence-based and what's not, when that person's also supposed to be an authority figure.
It's very hard. And all of the doctors who I talk about mixed good advice with bad advice. So I've been studying the anti-vaccine movement for a decade, and I've always been fascinated by anti-vaccine doctors. A doctor who I trained with here at NYU, a woman by the name of Dr. Kelly Brogan, morphed into one of America's most outspoken anti-vaccine doctors. This was in 2010 or so. However, she was not particularly influential, I think, during the pandemic, because people could tell that she was, kind of on the fringe. So she would she's a germ theory deniist. She doesn't believe HIV causes AIDS. She doesn't believe SARS-CoV-2 killed people. She thought people were dying of an epidemic of fear. I mean, really sort of out there stuff. The doctors who I discussed mix good advice with bad advice. So they would say things which are true, that for elderly people in nursing homes and for people with underlying conditions, they have to be very, very, very careful not to get COVID. It's can wipe out those populations. But for everyone else, it's just the cold. You probably won't even know that you're going to get infected. So I think that confuse people quite a bit, and they can speak in scientific jargon. They're introduced the way you're going to introduce me, with all of my credentials and so-and-so's and a professor of this and that at Stanford and Harvard and UCSF. And they appeared on Fox News, the Washington Post, the Wall Street Journal, the Atlantic magazine, talking very professional, wearing suits and ties. And so the general public was very confused by all of this.
Yeah. So, I mean, how maybe you can help us, because I think for a lot of people who haven't been like deep in it, like we've heard stories, we sort of know about certain reactions. Like you hear about, let's say, the far out there sort of anti-vax conspiracy theories about how like I don't know, there's like a chip in the virus, like, you know, you get like the extra kind of out there. But then you also hear the conversations about like myocarditis, or you hear the conversations about like mast cell reactions. Like maybe you can help us understand a little bit, what were some of the conspiracies? What are some of the conspiracies that have sort of persisted? And like, how do we separate fact from fiction here? You know, what's floating out there?
Yeah, so there's a lot. That's very hard to say, and I these days myself, especially the way Elon Musk is running Twitter, I have a hard time separating fact from fiction myself sometimes. So I think maybe a better question would be, or a way to reframe the question would be, you know, how can you know when to trust someone? I think the first thing is that they tend to speak a lot on very narrow topics. So, for example, you know, what expertise do I bring to the table? I think I bring two things. Number one is I worked throughout the pandemic. I saw what COVID could do with my own eyes. I saw how it could overwhelm hospitals. I saw that, yes, most people who died of COVID were older people, but not all. I learned that some survivors of COVID could be devastated. So it wasn't like you died or were fine. So that's number one. And then number two is my decade-long interest in the anti-vaccine movement. So I was really able to see how arguments that were previously made against the HPV vaccine or the MMR vaccine were repurposed for the COVID vaccine. And we can talk about that with regards to myocarditis in a second. Whereas, and admit error. So in my book and on my blog, on science-based medicine, on social media, whenever I goof, my initial reaction is to say, no, I didn't goof. But when I've been shown to make a mistake, I hope, I'm not always successful, but I try to acknowledge the error and do so very publicly. In contrast, as we've said, the doctors who I discuss have a very hard time admitting error, and they claim to be experts on every aspect of the pandemic, on transmission, on masks, on ventilation, on the effects of school closures, on everything. And everything seems to fit their preconceived narrative. They'll never share information that undermines their idea that COVID is harmless for children and they don't need the vaccine against it, for example.
Yeah. Yeah. It's gosh, it's there's just such a sea of rhetoric out there. And it's so unfortunate that some of it is presented in that very kind of classic pseudoscientific way, which is like, I love the term pseudoscience, right? Like bad science or wrong science or not quite science, because I do feel like there's always in like good pseudoscience, if I can say that, I'm putting air quotes on it, like a kernel of truth. There's always like a little bit of like legitimate science, like encasing the inaccuracies. And so it is really difficult for individual consumers to make good decisions because, to me at least, and maybe it's because I'm practiced in the skeptic community, the obvious bunk is obvious. But the less obvious bunk is where that in between area is like really, really nefarious. And I think if you talk to any average American, at least on the street, and you maybe gave them a quiz about COVID information, a fair amount of misinformation would be mixed in with accurate information.
Yeah, and that's a perfect segue to talk about vaccine side effects and vaccine myocarditis. So one of the things that the book tries to do, like I said, is really show how old anti-vaccine arguments were repurposed. So you mentioned that the vaccine can cause myocarditis, which is true. That is not pseudoscience. So let's talk about that a little bit. So vaccine myocarditis usually occurs in young men between the ages of 12 to 25 after their second vaccine dose. The exact rate of vaccine myocarditis isn't clear. There's about 30 studies from around the country, around the world that show some pretty different rates. But I think about 1 in 10,000 is a reasonable estimate of how often it occurs. So it's rare, but not zero. And then what about the severity of it? So with this, there is universal agreement that nearly everyone, upwards of 95% of people, have a mild case, meaning they spend a day or two in the hospital and they go home feeling fine. That's not 100%, and there have been some cases of deaths around the world. I'm not aware of any in the United States from the vaccine, at least the mRNA vaccines. And we have to be humble about the potential of long-term consequences. So I don't want to minimize this vaccine myocarditis. But there were certain doctors who spoke about this, and I mean this very literally, as a fate worse than death. So there was one doctor who wrote an article in December 2020, after about 5,000 young adults had died of COVID. He said, young adults should not live in fear of COVID. Their risk of death is very small. Fear of death is not a good reason to avoid COVID. And he gave all the statistics. Oh, your risk of dying is 1.00 or 0.00001%. Fine. Okay. 6 months later, he wrote an article saying vaccine myocarditis should be respected. So here's this doctor saying, don't fear death from COVID, but fear vaccine myocarditis. And this was extremely common, that doctors spoke about vaccine side effects as a fate worse than death. And to give you an example of how ridiculous this was, there were several studies that took blood samples of children after they had been vaccinated and found that a small number of them had elevated troponin, which is a marker of cardiac injury, even though they had no symptoms of myocarditis. So listen, maybe that's a big deal. Maybe it isn't. Who knows? But they treated that as a fate worse than death. So they would say, the risk of a child dying of COVID is much less than suicide, much less than drowning in car crashes, which isn't exactly true. But they would minimize literal death that way, but they would treat an abnormal lab value in a child who feels fine as a potential marker of some catastrophe. And again, these were not the Kelly Brogans of the world. These were not the germ theory deniers. These were doctors from UCSF and Stanford and Harvard writing in mainstream publications.
And myocarditis wasn't sort of the only one, right? Like, I almost feel like I was seeing a theme where almost every time there would be rhetoric around some sort of vaccine side effect. So Guillain-Barré, for example, or some sort of immune overreaction, like a mast cell issue or something like that, that the actual virus, the actual COVID virus, was significantly a significantly higher risk factor for those things than the vaccine itself.
Yeah, I think this has to do with the fact that people tend to feel worse about problems that we feel we cause rather than ones that we fail to prevent. So the naturalistic fallacy, and you can just sort of think about it this way. If you looked in your pocket and found that a $20 bill had vanished, you would feel much worse if someone had stolen that money than if it had just fallen out of your pocket. And so there's this idea that when a vaccine causes a problem, it's the equivalent of someone stealing the money. Whereas if the virus causes a problem, even if it's a much bigger problem, even if $1,000 fell out of your pocket, you feel not as bad because it's natural. It's just how things are. That's how kind of it's meant to be, etc. So yes, anything, at least amongst a certain class of doctors, anything the virus could do was minimized, again, including literal death, and everything the vaccine did was blown up way out of proportion. And again, this is exactly what anti-vaxxers did with measles before the pandemic. So you can read an article from 2019 from an anti-vaccine blog minimizing measles, and they would say things like, before the MMR vaccine in the 1960s, measles only killed 400 children per year, which is both true and a lot of children to die every year from a vaccine preventable disease. And they would go on to say more children died of asthma, more children died of this or that, which again is true, but not a good reason to let 400 children die of measles every year. And then fast forward to 2021, and you would read doctors making that exact same argument about COVID. Only 500 children died of COVID this year. More children died of XYZ. So the exact same language, the exact same arguments.
Do you think that there's a bias, and maybe this only applies to the first several months, sort of when our hands were a little bit tied, when we were watching this horrific public health tragedy unfold and feeling this sort of wave coming at us that we were a bit impotent to do anything about? Do you think that there's sort of a bias, especially among experts, especially among those with a voice, to, I don't want to say minimize the risk, but to, I don't know how to put this, reduce like a fear that panic might be worse than the virus itself? Like, did we see that early on?
I don't know if we saw doctors saying that. I don't know if that actually happened. But yeah, there's a whole chapter of the book which is devoted to just this. Doctors, again, mocking anyone who tried to avoid the virus, saying that there was a panic. They even coined new phrases, coronaphobia, for example, about people who were too terrified of COVID. And again, this echoes pre-pandemic arguments and language that anti-vaxxers would make against measles. They would say, "Oh, every time there's a measles outbreak, oh, people are panicking. Oh, there's such a fear." But fear is good. At times, it's certainly unpleasant, but graveyards are full of fearless people. A lot of people live their lives without fear of COVID, and they're not here to tell us this story. And I think a lot of the doctors who use that rhetoric, sort of what motivated them. That's one of the questions you kind of asked me early on. I think a lot of these doctors got famous and made careers out of being a little contrarian, being a little different. And there's value in that. We need people to think outside the box. And of course, the best example of this pandemic is Karina Kareko. I'm going to butcher her name. I always do that. The scientist who just won the Nobel Prize, and boy, she deserved it for her work on the mRNA vaccines. So we need people to think outside the box. But these guys just couldn't turn that off. So when everyone else was saying, COVID is going to be very dangerous, it's going to be horrible, they couldn't not be different. They just had to be different. So I predict that if everyone else was minimizing COVID, they would have said, COVID is a big deal. We need to worry about it.
So you do think that there was sort of a contrarian bent there?
Absolutely. Yeah. Again, that's what I think motivates people like Kelly Brogan, Andrew Wakefield, Sherry Tenpenny, all of these sort of famous names in the anti-vaccine world from before the pandemic, is whatever mainstream medicine says, they have to be against. And they will call that thinking for themselves. And I think that that infected a lot of other doctors during the pandemic. But sometimes the majority is right. Sometimes, so when the majority said COVID is something to be feared, and when the vaccines arrived and they said, everyone eligible should get vaccinated, including children, the majority was right.
So, I mean, I think it's an important question and something that I know you talk about in your book early on, and we sort of skipped over. But I would love to maybe hear just a little bit, about your experience. I mean, you were there on the front lines, you were at NYU, you were seeing individuals who were coming in back when this virus was pretty mysterious, back before we had appropriate treatments available. And, you're not just speaking from as a person who has dug deep into the literature, but you're speaking as a person who was at the bedside of people who were actively dying from this disease. So I'm just curious, what it was like for you personally being there on those front lines.
Yeah, so I always describe my COVID experience as don't think I did a lot, but I saw a lot. And my COVID experience was, and pretty much every New York doctor will say the exact same thing. It was very intense in the spring of 2020, but not much after that. So during April and May of 2020, our hospitals were taken over by COVID. There was nothing else in the hospital other than COVID. Bellevue, where I worked, we're located in Midtown Manhattan, a relatively well off area. Our emergency room was never deluged. Some of the scenes that took place in Queens and Brooklyn of, essentially people dying in the parking lot, we never had. But those hospitals transferred their patients to Bellevue. So we had about 50 to 60 new arrivals every single day. And our ICU, there's usually one patient per room. There were two patients per room, and every available clinical area was devoted to the care of COVID patients. We had gynecologists caring for men. We had pediatricians caring for seniors. We had nurses come from all over the country. So I heard a lot of Southern accents. I grew up in the South, and a lot of accents reminded me of home. And so it was very different that way. And I saw more people die in the spring of 2020 than I probably my entire career. One thing about COVID in New York City was the sounds. So everyone heard, and you can probably hear through the microphone, there's some
Oh, yeah.
sirens, some sirens, wailing through the windows. But the streets were totally empty other than just siren after siren after siren. And inside the hospital, it was code blue to this room, code blue to this room, code blue to that room. That pager usually goes off once per day at Bellevue, and it was going off every 5 to 10 minutes. And it was a very tragic time, but it was also kind of an inspiring time. People stood on their balconies and cheered for us, and they sent us all sorts of food and nice cards, which was appreciated. But there wasn't anything to do for these patients, right? So a lot of our patients, as I said, they came from other hospitals, and they came. Doctors were desperate to try everything, so they all were on hydroxychloroquine and azithromycin, these sort of Hail Mary treatments. One rule that I had is that because I eventually ended up running a COVID team during May of 2020, I said none of our patients are going to be on experimental treatments unless they're clearly dying and you have nothing left to lose. So I stopped all of those treatments. But it was a horrible time. I would leave work every day at 6 or 7, and I would come back the next morning, and half of the patients who I left the day before had died or been transferred to the ICU overnight. So I just to repeat, I saw more death during that time than I had my entire career. And eventually those scenes played out at pretty much every hospital in the country. I don't think any hospital was spared that. Those sort of scenes of mass death. There were these giant refrigerated trucks behind the hospital and used to store all the bodies. Some hospitals needed forklifts to move bodies into into these trucks. And there's a movement now to deny that this ever happened. They will say, emergency rooms in New York City were empty, which was true for my emergency room. Very few people came in through our emergency room here at Bellevue. But again, we had patients transferred from every other city throughout the hospital, or every other hospital throughout the city, excuse me.
So obviously you had never seen anything like it. And I'm just curious, when you sort of started to do a lot of deep, more like journalistic work into documenting the different conversations that were had on social media, the different rhetoric that we saw, both in sort of the public arena, like, official messaging from the White House and from different organizations within the U.S. government, and also just individual people speaking out on social media or on their blogs. Did you get the feeling that a lot of the people who were intentionally peddling, let's say, disinformation as opposed to misinformation, right? So misinformation, getting it wrong, which happens, and hopefully sometimes iterating, disinformation, agenda driven, intentionally, having spreading incorrect or pseudoscientific um, content. So did you get the feeling that those who were sort of peddling disinformation weren't there? That they just, like, didn't have this frontline experience? Or do you think some of them had it and they still were pushing this information?
So I think very few people who saw what COVID could do with their own eyes ended up spreading disinformation. And that takes a specific kind of maliciousness, where for the most part, you're not going to wind up on the front lines in the first place because you have to get through medical school or nursing school or respiratory tech school in order to have been on the front lines. So I think the malevolent types, the pure disinformation types, were very unlikely to have ever treated COVID patients. And I will say their campaign against the COVID vaccine, this was unearthed later by journalists, began in February 2020, even before the first person had died in the United States of COVID. They were already getting ramped up. In terms of the doctors who I speak about, again, yeah, very few of them treated COVID patients, and that really shows, because they say things that no one who treated COVID patients would have said, such as these were just old people who were about to die of natural causes anyway when they happened to contract COVID, or you're not really sure that COVID killed these patients, or that hospitals were overwhelmed by people who were afraid they had COVID and they were just the worried well. So they said things all the time that no doctor who treated COVID patients would say. And I'll say it took me a while before I sort of realized, oh my gosh, these guys don't know what they're talking about, because I fell I fell prey to the exact same things that I was talking about, that they spoke with great confidence. They had amazing credentials. They were, I thought, entirely trustworthy people. So when these guys were saying in April 2020 and May 2020 that COVID is on its way out, that we think we're approaching herd immunity, that we're past the peak, that the virus was much more widespread than we already thought, and that half of the country, they didn't quite say half, but large numbers of people had already been infected without us even knowing it, I believed it, or I had no reason to doubt it. It was really only when the dust had settled and I went back and started rereading what people were saying at the start of the pandemic that I was like, oh my gosh, these guys were just kind of making it up from the comfort of their couch.
Yeah. And so, I think that a lot of us saw the panic, the fear, the confusion in the early days when the vaccine was first released. Then we saw that people were getting vaccinated, and that the virus was changing, and that even though the virus continues um, to mutate, that the death toll has significantly dropped. The severity um, of the outcomes of getting sick has changed because of a lot of things. Because we are getting vaccinated, because we do have things like Paxlovid and different medications available, because we aren't overtaxing our emergency rooms, our hospital systems. But I'm curious, how do you think things are netting out now? Like, what do you see is the COVID landscape today versus how it was during the sort of, I don't know, the intensity of it all early on?
Yeah, obviously it's nothing like it was in April of 2020. And, perhaps the saddest reason that is because vulnerable people have already died. There's a term in epidemiology called mortality displacement, which is, the virus has already sort of killed all the people that it's going to kill. Although that's not entirely true. I think at this point in the pandemic, I don't know if anyone has a really good sense of what the what the virus is doing, what the actual numbers are. I read that around 1,000 people are dying of COVID per week here in the United States, which is much less than previously when 2 to 3,000 people were dying per day, but not an insignificant number of people. And I think maybe at this point in the pandemic, it can be hard to tell if someone is truly a COVID death, meaning, let's say, a 50-year-old gets COVID and 2 months later has a heart attack. Was COVID to blame for that? It can be a little bit hard to tell. And I think at this point in the pandemic, we're worried not a lot as much about death as much as we are about disability and long COVID. And I think that people like myself who were kind of shell shocked from the mass death have maybe not paid as much attention to long COVID as possible, because it's sort of like, well, you're not dead, so you have nothing to
Right. Like
complain.
it's like a triage bias, right? But now we're seeing like, yeah, really intense. I have a friend who has this like horrific long COVID, like I guess it's I don't remember what it's called. It's a bunch of letters, but it's like a mast cell reaction where her body just has these like horrific immune attacks, and it's made her so incredibly sick and disabled. And it's just, I cannot imagine living that way.
Yeah, no, I know some people who've had to quit medicine for that reason. Not many, but definitely some. And so I think the harms are a little bit more invisible now because, these people are probably sequestered at home, right? They're not out in the community interacting with us, telling us how sick they are. And a lot of them look healthy, right? So it can be hard to see, and it's impossible to see invisible disability, for example. So, and I think we have to be humble about the potential for unknown consequences of repeat infections. If a newborn is born today and they're infected 10 times by the time they go off to college, what is that going to do? I mean, most kids will hopefully be fine, but hope is not a plan, and time will tell.
Yeah. So I'm curious, for those who are listening to the show who are like, oh, okay, my vaccine card's pretty full. I personally, because I was working in a hospital setting, I'm into my second vaccine card. We have this new vaccine that's available now in the winter of 2023 that you can get alongside your flu vaccine that is an adjusted vaccine. It's intending to sort of keep up with these mutations. But for those who are sort of weary or who are not wary, but weary, like they're like, I've been shot so many times. I've had the virus, multiple times. Like, I'm good, right? Like, tell us why it's important that we keep up with the vaccine schedule.
So far, I'm unaware of a vaccine dose that hasn't helped on average. This is especially true for older and vulnerable people. But people have a very strange attitude toward vaccines that they don't have towards other aspects of their health, right? Like if I told you I'm not going to the dentist because I've gone for the past 10 years, you would say that that's crazy, right? Or why do I need to go to the gym? I worked out, for the past 5 months. People recognize that certain health practices, in order to be successful, need to be maintained. And I would say that getting a vaccine is much easier than going to the dentist or going to the gym routinely, even though vaccines, none of us enjoy the actual process of getting vaccinated. We get a sore arm and some of us feel pretty rotten the next day. And at this point, we don't have a ton of evidence that this new vaccine is going to be beneficial. And I think a lot of the doctors who I write about use that to their advantage. They will say, where's the randomized double-blind placebo-controlled study showing that you need these sorts of boosters? But this is what happens, as we've learned in a pandemic, is that you have to make decisions in real time without the luxury of the best, highest quality of evidence. For example, had we done a randomized controlled trial of the booster last year in 2022, we would have known in 2023, after the wave had already subsided, exactly what to do. So you have to make decisions with incomplete information, and choosing not to get a vaccine is a decision. even though, as we discussed, it's not often perceived that way. So listen, so if someone has had 6 vaccines already, they've been infected 4 times, what is the benefit of a additional vaccine now? I don't really know, but I think that on average, just to repeat myself, there has not been a vaccine dose that I'm aware of that hasn't been shown to be of some benefit to at least some people. And I think it's not super duper hard. Probably the hardest part actually is getting an appointment and finding available vaccine. The vaccine rollout has been horrific. But if your local drugstore has it, I live across the street from about 3 of them here in New York City. I just went across there and got a vaccine, and my arm hurt for the next day. It was not a big deal.
Right. It's I worry sometimes that it's about more than just the I how do I put this? So I just finished my PhD, as you know, and I am in between my internship and my postdoc, which means that I am one of the, many, many Americans who's sort of in between health insurance. Open enrollment has started. I'm gearing up to get my sort of Obamacare to cover me until I start my postdoc. But I went down to like my local pharmacy and said, "Hey, I just want to get a flu and a COVID vaccine." And he was like, "Without insurance, it's going to be like $250 for both of those." And I was like, my mind was blown. Like, they all advertise free flu shot, but then in the fine print, it's like, with your insurance. And it used to be that COVID vaccines were covered, that we had government, money set aside to ensure public health. But I guess that has now dried up. So I think that sometimes, sadly, this move towards vaccination and public health and wanting to do the right thing is squashed by finances.
Yeah, no, you're absolutely right. And I'm halfway done with an article for Science Based Medicine where I talk about this and I discuss how vaccine advocates like myself have focused exclusively on the science rather than on the economics of vaccines. And Pfizer, even though they got oodles of public money to develop this vaccine, are doing what companies do. They're charging as much as they can for it. And I was always kind of mystified why vaccine advocates were called pharma shills. Obviously, this has earned pharma gazillion dollars. It was the number 1 best-selling drug last year. But uh, but I was mystified because vaccines traditionally save a lot of money by keeping people out of the hospital. But these drug companies, they make people feel like they just want to extract every penny from everyone's wallet and by charging as much as possible, which they do. And I think vaccine advocates like myself have been kind of too silent on this, which is why we are called pharma shill. So hopefully I will publish that article once I get all the sentences in the correct order and say, yeah, I think this has been a problem that skeptics and vaccine advocates have not spoken out as much about the economics of vaccines and the fact that a lot of people, $200 is a huge amount of money for a lot of people. And I don't blame someone for skipping the vaccine when they can use that $200 to pay rent or buy groceries.
Yeah, and it's the calculus is really difficult. Like you said, I need to eat now. I may or may not get sick. And I think people often think that way. Like, it's just so clear to us that like the way you're not going to get sick is to prevent yourself from getting sick. But a lot of people are willing to, or sometimes are forced to take that kind of gamble. Um, or you'll see, I think the mentality, and maybe it's important for you to help answer this, of individuals who are like, well, the last time I got vaccinated, I got sick anyway.
Right.
So why should I get vaccinated? Like, how do you answer your patients when they come and they ask that question?
Yeah. So the main disease that I treat actually is multiple sclerosis. And with one exception, all of the MS drugs are designed to prevent bad things from happening. So I have this whole sort of speech that I give, which is to say that these medications, and this is true of vaccines, are like are like an invisible suit of armor. If you were in a sword fight, that would be weird. But let's say someone cut you, and then you put on your invisible suit of armor. That suit of armor would not feel good. It would not heal the cut that was already there, but it would protect you from future sword blows. And if you're in the middle of a sword fight, you would notice the armor protecting yourself, but the good that the vaccine does is invisible. So let's say you saw someone who gets vaccinated and they get COVID and they don't get hospitalized and they don't die. You can tell that person there's a perhaps a chance, we'll never know for sure, that it was the vaccine that made your illness much milder than it was. So that's how I try to say it. Or it's kind of like a seatbelt, right? If I was driving from New York City to Boston this week, I would probably be fine if I chose to make that ride without a seatbelt. But wearing a seatbelt just puts the odds of a healthy, safe trip in my favor. Obviously, the benefits of a seatbelt are plain for all to see, whereas the good that a vaccine does is invisible. So I think that's why you have a hard sell.
Yeah. And I think the other question that is sort of the obvious follow up, and maybe the last question that I've got for today is what's the difference in protection between vaccine immunity and natural immunity? So, for individuals who are either both vaccinated and have had the virus several times, or those who are vaccinated and who have never been sick, or those who have been sick a bunch of times but haven't really been vaccinated that many times, like how do you as a physician think about that calculus and, how we can be best protected?
Yeah, so everyone uses the phrase natural immunity, myself as well. But we should know that the immunity induced by vaccines is completely natural.
Right. Yeah.
The immune response it triggers. Don't worry, I use natural
Yeah.
immunity as well. I mean, so I tend to think about them in pretty similar terms. That if you're vaccinated or you're getting over a COVID infection, you likely have very good protection, but for a relatively short period of time. So I think that future generations will just get used to their annual COVID shot the way we're used to an annual flu shot, or we're used to going to the dentist every year, or we're used to doing many things on an annual basis. And I hope that the COVID shot becomes normalized in that way, because as I've said, every dose so far has been shown to help keep people alive and out of the hospital. Again, it's much more beneficial for people who are older and have underlying risks, but there's some benefit for younger people as well. And the risks are so low. The risk of myocarditis from the boosters is like 1 out of 100,000. I mean, it's extremely low. So it's just a question: is you're kind of a gambler, right? Where's the real downside? A sore arm and maybe feeling sick for a day. That's the best I've got about the
And
downsides.
even if that, I found, and maybe this is anecdotal, I don't know, but that each booster that I've gotten, my reaction, like that feeling of being ill, because I was quite ill from the second dose of the first shot. And then each subsequent booster, I would get ill, but it was like less and less and less, to the extent that my very last booster, I think I felt sick for like an hour, which was amazing compared to how, oh my God, I was sick for like a whole weekend during the first vaccine.
Yeah, no, me too. My last booster, I noticed nothing. So, if there's some potential benefit and there's virtually no downside, I say why not, right? If someone was going to hand me a free lottery ticket, I'd say it's probably going to be worthless. But hey, why not?
So, okay, I know I said that was going to be my last question, but I have another follow up. What are the odds, do you think? Like, what is it looking like for having some sort of multivalent shot in the future where we don't have to get two jabs for flu and COVID, but we get an all in one vaccine?
Oh, I will plead the fifth on that. I don't know the exact answer to that.
Are you
You know,
hopeful, maybe?
I'm really hopeful about is a pan coronavirus vaccine,
Ooh, so like a
or
cold kind of resistance as well.
a sterilizing vaccine, kind of like we have for measles, meaning that you can't get infected and you can't pass it on. So something that really induces immunity, not just deep in your lungs, but in your sinus passages as well. That's what I'm really sort of hoping for, and it's a reason to try to avoid COVID infections for now. I think I'm not the most careful person on the planet, that's for sure, but I'm more careful than most people. Just got done flying, and I wore a mask on the airplane. And I'm hopeful that in a few years we'll have much better vaccines available. Time will tell.
So, before we sign off, I'm just curious. Obviously, there's so much to cover. There's so much in your book. Is there anything that we didn't discuss that you feel like it would be really important to bring up?
I would just say what can we do about all of this? And I
Yeah.
think I've been a little bit dismayed at my own profession. 99% of us doctors behaved admirably. We rushed in to treat COVID patients fearlessly, and decent number of us paid for that with our lives. But I think when it comes to misinformation, there's just this sort of attitude of, I think David Gorski called it shruggies, meaning people just sort of, whatever, some doctor says something, what am I going to do about it? And I think that, we all need to do what you do on the Skeptic's Guide to the Universe and on this podcast, which is not to silence anyone, not to try to get anyone fired, but just to speak up about gross misinformation and say this is not acceptable. And I do think the tide is turning a little bit that way, in that certain doctors are receiving pushback for spreading misinformation that they didn't used to. And we just need to say this is unacceptable for our profession, any more than it's acceptable for a firefighter to start a fire.
Yeah, yeah. Good points all around. So everybody, the book is, I have it queued up here. I want to read the full subtitle. The book is We Want Them Infected: How the Failed Quest for Herd Immunity Led Doctors to Embrace the Anti-Vaccine Movement and Blinded Americans to the Threat of COVID, by Dr. Jonathan Howard. Jonathan, thank you so much for spending time with us today.
Oh, my pleasure. Thank you so much for having me. I sure appreciate it, Kara.
And everyone listening, thank you for coming back week after week. I'm really looking forward to the next time we all get together to talk nerdy.